Hello, and thank you for tuning into Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people who are making it happen behind the scenes. I'm Dr. Bobbi Pritt, chair of the Division of Clinical Microbiology at Mayo Clinic in Rochester, Minnesota. With us today is Dr. Erin Graf, Associate Professor of Laboratory Medicine and Pathology at Mayo Clinic and co-director of Microbiology at Mayo Clinic, Arizona. Dr. Graf, thank you so much for joining us today.
Thank you for having me.
So, Dr. Graf, your teams in the Division of Laboratory Medicine at Mayo Clinic, Arizona have implemented some exciting new automation tools in the last few years. Can you tell us about this journey and what tasks you've automated in your laboratories?
Sure. Thank you so much for the opportunity to speak about one of my favorite topics. We're
Hmm.
so fortunate in our lab that we were able to purchase and implement a very large automation system with the support of so many here at Mayo Clinic, all the way up to our CEO, Dr. Richard Gray, who really saw the future state benefits of this automation system. So we started exploring potential systems, as you know, Dr. Pritt, because you were
Mm.
involved back in the fall of 2019, which was right as I arrived here. And because of course there's multiple sites within Mayo Clinic, three major hospital campuses, we made a very cohesive effort to come up with a huge list of questions about the pros and cons of different systems that we wanted vendors to answer, and then decide as a group which system really fit our needs the best. So we were lucky to be also given a brand new lab space around that same time we were planning that space, and that made it a bit easier for us to design that floor plan around the automation. So we kind of moved in with everything at the same time, and we officially went live with the system in February of 2023. So we've been live almost 2 years now, which is hard to believe. And it's truly been smooth sailing since that time. So, to answer your question specifically about what tasks have been automated, our particular system includes historically manual functions involved in putting a specimen onto agar plates, incubating those plates, and then reading the plates in quotation marks. Let's say reading the plates, and I'll talk more about that in a bit.
Well, thanks, Dr. Graff. And you're right. This has been truly an enterprise endeavor as we've talked about our three main sites and then, of course, the Mayo Clinic health systems. And so we've had involvement. And you were one of the leaders, which was. It was very exciting. I remember those times. Of course, the pandemic derailed us a little bit, but here we are now. So, how has the introduction of automation changed your day-to-day operations, and what are some of the biggest advantages you've seen so far?
Yeah. So as I mentioned, the system that we selected does all of the manual steps for us. So things like uncapping a specimen, inserting a loop into the specimen, streaking out that specimen onto the agar plate for isolated colonies, incinerating that loop and waiting for it to cool. All those things that our folks used to do very hands-on work, they can now take that time and put it towards more complicated tasks. So, really letting them kind of work to the top of their skill set, doing things like processing a complex tissue specimen where, they might want to look at it and decide, okay, which area of this tissue is the most purulent or has the most necrotic material that I can kind of go after and use for my plating portions. So, those mundane tasks of the huge volume of specimens that we have in our lab can all be done through this automated system. And so on the plate reading side of it, that's also been a really neat change and adjustment. So if you think about the way that our techs historically worked up their auger plates or their cultures, they'd come in the morning, they'd pull racks and racks of plates out. And you don't know at the outset when you have that big rack of plates, which ones are going to have some growth on them, which ones are going to be no growth, and you just start kind of flipping through them, and you take maybe an hour, maybe more depending on how busy, to just kind of organize and triage your plates, and that's really wasteful work. And so the automated system now, they're seeing all these images as they're ready to be read digitally, so they don't have to pull plates out and open them up and look at them. The images are right there on the computer for them to read, so with a click of a mouse they can quickly say no growth, and that moves it into a different queue. Or, hey, there's growth. I think I need to go after this and work this up. And now that goes into a priority queue. So it's that the shift in doing a significantly less amount of manual work, but also that digital face of it that's been a huge advantage for us.
Yeah, it just makes it so much more efficient, doesn't it? And
Exactly.
I love what you just said too about allowing our staff to work at the top of their license, get rid of some of that more tedious work that wasn't is essential, but maybe is not the highest value that our highly trained staff can bring. So talking about staff though, some staff are wary of automation. So how has automation affected the roles and responsibilities of your lab staff?
Yeah, I think this is such an important topic to continue to talk about with any kind of change, but certainly especially with automation, because there's, of course, a very natural fear. And I think we all have this fear with AI, right? AI coming in and really taking over so much of our spaces is, will I be necessary anymore? Is my job secure here? What am I going to do?
Mhm.
And really, we I think have reassured the staff that again, as I said earlier, we still need you for those really high value tasks that only you can perform. We're never going to be able to automate looking at a tissue and deciding how to process that tissue. Looking at a complex specimen that maybe the orders are not entirely clear, or there might be some things missing. Those are front end processing pieces that really need a brain. And again, this automation frees up our people to focus on those really high level tasks. And so, people were appropriately apprehensive at the outset. We were, as I said, fortunate to have a brand new space that the system was going into. So we could bring people down in small groups and kind of slowly introduce them to the automation, let them try it out, let them be a part of that validation process so they could get their feet wet without, having to drink from the fire hose, so to speak.
Mhm.
So I think not all labs have the luxury of being able to do that. Of course, if you're retrofitting automation into an existing space, that is more of a challenge. But kind of that gradual, getting comfortable, getting to know the instrument, and boy, now if this system were to ever go down, knock on wood, in our almost 2 years, it has not gone down. But if it did, I think mutiny would maybe be the word that I would use. Everyone just loves it and can't
Mm.
imagine life without it now.
Well, it seems like with your leadership and your team, you did a great job with change management, which comes to my next question is what strategies did you use to ensure that smooth transition and that positive experience among your teams? And I know you've addressed that a little bit, but can you elaborate for our audience?
Absolutely. Yeah. This, again, so key to big, big, big changes like this is you have to really engage everyone involved as much as possible. So we thought a lot about workflows. We sat in conference rooms, day after day, talking about workflows because we didn't want to take kind of our existing SOPs and make this system fit those SOPs. We wanted to just think outside the box and say, okay, I know this is the way we do things now, but when we bring in the system, are there better, more efficient ways we could do things? And do we need to then adjust our SOPs to match that? So we brought every stakeholder or every key person in that process to the table to talk through. I know this is the way we do it now, but what would you like to see different? How could we do this better? And so making them a part of that decision making process before we made, SOP changes or before we decided how we were going to use the automation was really, really impactful. And then, as I said, just talking about it a lot. We did quite a few presentations for the staff. Our technical specialist too, who was our primary lead on this project, Felicia Rice. She was just incredible with piece by piece, she'd give them little nuggets of information about the system during our lab meetings. She'd do kind of PowerPoint style presentations and talk through each of the different components, and that definitely made a lot more comfort in the transition.
Well, it sounds like you did a really great job with change management and having your leaders on board, and then the gradual introduction. Having the boots on the ground, people engaged is just so important. So, congratulations on a successful and very large implementation and complex implementation. So, looking to the future, how do you see the role of automation evolving in medical laboratories, clinical microbiology laboratories in general?
always like to take the opportunity in any interview or presentation that I give to highlight what we know is a major problem nationally, which is the shortage of folks going into this profession.
Yeah.
So there is going to come a time, and a lot of labs across the country. And perhaps internationally as well, are really feeling the pain points of this staffing shortage. Um, Medical laboratory scientists, clinical laboratory scientists, formerly medical technologists. It's a highly specialized education. They have a 4-year degree and usually some additional training on top of that with a license and certification. And they work, 24/7, 365 in most laboratories, right? So we have our people working holidays, our people are working weekends, and so it's easy to burn out. You're a behind the scenes partner in patient care, and so you're not always, directly connected in the patient care, even though you are behind the scenes. So it leads to some burnout, and we see folks going off to IT jobs, other jobs that are maybe more lifestyle friendly in terms of not having to work every holiday and weekend. uh, our folks are just across the board in this profession, probably undervalued in terms of pay. So it really just doesn't attract, unfortunately, folks to view this as a long-term career anymore. So that's where we're going to need to lean on automation. And so some of the things we're excited about with this particular system that we have is the AI capabilities of the digital reading. So we have all these digital images. The AI can actually call those cultures negative or no growth. And we can get to a point where with a click of a mouse, we can take, 20, 30, 40 cultures in a aggregate image and say, yep, okay, negative, no growth, discard, done. So automating or even replacing some of that reading ability with AI will really help with some of the staffing shortages that we're seeing. And I know, obviously, Dr. Pritt, in your lab, you're a huge proponent of AI for your smear-based or your parasitology
Mhm.
images, and I know you similar issues there where that's a very high level of expertise to be able to read those oven
Mhm.
parasite slides. So similar pain points in culture reading. We're really looking to leverage automation to solve some of those issues.
Well, I'm really glad you brought that up, Dr. Graf. First of all, I hope people that are listening consider medical laboratory science as a career. But I think the reality is that there will be national shortages that will continue. And so we want to make sure that the people we have are happy and feel fulfilled with the work that they're doing, and that we're really using their skills to the greatest extent, and that we're not giving them just boring, ergonomically challenging tasks that could be done through automation and AI. And that's the best way to use it. I love how you said that your staff love this automation system and they're so happy with it. That would be the desired outcome, is that they see it as a tool that makes their job easier.
That's exactly right. It's a supplement to those in this career path to say exactly that. We're not going to burn them out by having them work through huge piles of culture reading when we can take some of that and just push it out through the AI or automation component. Yeah, agree.
Yeah. Well, thank you so much for joining us today. This was a great discussion. And I'm thinking that we will have you back in the future to talk more about automation and many other topics.
Thank you so much for having me.
Thank you so much for tuning in to Answers from the Lab. Be sure to subscribe to this podcast and don't forget to tune in every Thursday and every other Tuesday.